On today's Two on Your Side Town Hall, we talk so much about vaccines, and rightly so, but testing remains critical, and there's a major milestone to tell you about. We're going to discuss that with the Chancellor of SUNY, who will join us live.
Plus, with new CDC guidance out for vaccinated people exposed to known cases, we're verifying what we know about the possibility that you could still spread the virus.
And a Western New York native with a very familiar name representing us well on the international stage. We're going to talk to this tennis star's childhood coach at the end of the half hour.
And we thank you for being here, everybody. I'm Kate Welshofer.
And I'm Michael Wooten. So when you're fighting a potentially deadly virus that has led to a pandemic, numbers matter. They're how we monitor progress and identify weaknesses. And we want to share with you here a key number, 56 million. That is how many doses of vaccine have now been administered, nationwide. It's about 78% of all the doses delivered that have gone into arms. But what about New York State? Well, you can see here we've gotten about 4 million doses and administered 79% of them, a little more than 3 million shots into arms. Slightly better than the country as a whole.
And of course, getting people vaccinated quickly is crucial, but as that plays out, testing remains critical. We want to focus on that tonight. There are concerns that we're just not doing enough testing nationwide, particularly in light of these new variants of the virus.
But juxtapose that with the big news from the State University of New York, or SUNY, which is doing a whole lot of testing. In fact, SUNY hit a major milestone, surpassing 1 million tests administered since the start of the school year.
And just remember that all students had to get tested for COVID ahead of the spring semester, with weekly testing for everyone on a SUNY campus to track any potential surges of the virus. So joining us live right now is Dr. Jim Malatras, the Chancellor of SUNY. Thank you so much for your time tonight.
Great to be with you guys.
Dr. Malatras, we just mentioned the SUNY milestone. It's pretty incredible. 1 million tests administered. Clearly that is going well, but there are worries, as we mentioned right now, generally speaking, that we just aren't doing enough testing as a country. Want to start the show here by listening to what the White House testing coordinator said earlier today.
We need to test broadly and rapidly to turn the tide of this pandemic, but we still don't have enough testing, and we don't have enough testing in all the places it needs to be. Today, we're taking a critical step along that path.
So she said we're taking a critical step right now. In response to that worry, the federal government is going to spend a little more than $1.5 billion to expand testing in schools, manufacture testing supplies, and do more sequencing. You've been living and breathing coronavirus testing for almost a year now. Your reaction to the White House announcement, and what have you learned with testing at SUNY that can help New York State make sure that we keep up with the testing demands?
Well, I think the White House has it exactly right. Vaccine is what's going to win the war, but testing needs to monitor the situation. For some time, I think we have at least a couple of years of testing to make sure the virus stays at bay. New York has been a model. We do a lot of testing in the state, upwards of 300,000 a day. At SUNY, 1 million tests since the beginning of the fall semester. More testing than some states have done since the beginning of the pandemic. And our positivity rate's 0.5%, really, really low. What it's allowed us to do is open up more of our facilities. We're the largest system of higher education in the entire country. Many systems went all remote. We wanted to bring many of our students back. And we can pinpoint and monitor and then isolate cases as they emerge, as opposed to taking these draconian actions that some systems had to do, closing down systems, things like that, which is really disruptive. So it's allowed us to monitor the virus in a much more data-driven way. It's been a godsend for us. But what I love about this, we developed the test right at SUNY. SUNY Upstate Medical developed it, the #1 saliva test in the world, which picks up pre-symptomatic, asymptomatic cases. Those are the cases you want to catch on a college campus, because when you're sick, you can know about it and isolate it. We want to catch those kids passing around the virus before they have symptoms. So it's been a game changer for us.
Well, the state is in the process of building a new facility at the University of Buffalo to further expand the capabilities of testing. So what is the progress on that facility, and how will it be used once it's finished?
It's going really well. We're still looking at a beginning of March start date. I was proud to give about $120,000 from SUNY to build that. That's an Upstate Medical University of Buffalo partnership, which is going to go a long way. It's going to expand our capacity about 150,000 tests a week. We hope to serve more of the Western New York region. We're going to take care of our schools, But what we've begun to do, which I think is really important as a New York State society matter, is going into our K through 12 schools and helping them test, going into other areas like not-for-profits to help them test, because I think ultimately the more we can help test, the more things we can open up as we're vaccinating folks.
We've been warned from the beginning of all of this that the virus could mutate, right? And we are now really seeing a lot of those variants pop up, not just, coming from other countries in many cases, but we're seeing them all over the United States right now. The CDC director gave us this warning on that topic today. Let's listen to that.
The continued spread of variants that are more transmissible could jeopardize the progress we have made in the last month if we let our guard down.
I think that speaks to how important the testing is. So the question, Dr. Malatras, is how well are the current tests doing at detecting these variants, and what is the plan to continue to improve that going forward?
That has been a major concern for us because the latest variants are more transmissible. They don't know if they're more deadly, but they're definitely more transmissible, right? And this is about containing the virus. Our SUNY saliva test captures all the variants. So we know if we get the UK variant or the other variants, that has helped us monitor and manage this. Luckily, we haven't had any of those variants pop up on our campuses yet, but our test captures this. So we're hopeful that we'll be able to keep whatever mutation at bay on our campuses as they emerge.
Obviously, right now, most of your SUNY students are not yet eligible for the vaccine unless they have a qualifying comorbidity. But looking ahead, in a few months, that's going to change. So what is the plan to make that a smooth process once there are enough doses so that students can get immunized?
We've been putting the infrastructure on place for the state and our local partners. One of the things we did was offer up every one of our 64 colleges and universities all across the state. About 36 of our campuses now are a vaccine distribution site for the state of New York or a county government. So in a way, we've built the capacity to vaccinate our students when that opens up because they're right on our college campuses. So we're giving back to society and the state more broadly now. And we've now built the infrastructure for when it opens up to our students as well.
I want to ask you bigger picture about how things are going on the SUNY campuses right now. You mentioned a moment ago that your percent positive rate was 0.5%. Just so people can understand that, that means 1 out of every 200 tests is coming back positive. Correct me if my math is wrong, but I think I got it right. Put that into perspective for us. That's an incredibly low number. That's exactly where you want to be. This is why I'm glad we're having this conversation tonight, because it speaks to the importance of testing. There's so much focus on the vaccine right now, but getting to herd immunity is going to be months and months and months away, and we can't let the testing fall off between now and then. So is that what has enabled things to go pretty smoothly? Should parents watching right now have confidence that their college-age students are in pretty good hands?
Absolutely. Testing, testing, testing. That is really what's made this able for us to open up our campuses again. You said it exactly right. Just take the University of Buffalo, Buff State. Their positivity right now is less than 1%. It's about 0.5%, 0.4, and 0.7%. The region's positivity rate is 3.5%. In some level, we're more concerned about the outside virus coming in from the community. So by testing our students regularly every week, we can monitor very quickly and isolate very quickly before it gets out of hand. We've had a couple of blips along the way, but we've required pre-testing of all of our students before they came back. So we kept the virus at the gate of the college. We didn't let it in this time. We pre-tested everyone. We isolated those problems before, and that's allowed us to bring many of our students back successfully. And it's going quite well, and we hope, knock on wood, it stays that way.
This has certainly been a difficult time for students, no matter what their age group. But what has been the feedback from students who are coming back?
I think they have been the most resilient of us all, and they have really stood up in a major way. They are happy about the testing. They show up for the testing because that allows them to do more. We want to open up more of our activities on campus. This has been an isolating experience for all of us in the state and all of us in the world. But especially for college students, living on a college campus by yourself in a dormitory with less things to do, really isolating. So I think by testing, we're going to try to get our athletics back going, like some of our colleges like UB are doing across the system. We're going to talk about commencement, not the big 10,000, 20,000 person commencements, but smaller commencements to really demonstrate some more activities. But our students have been great. But we've been focused on mental health. We did a program in the fall to give mental health services to all 400,000 of our students. We're focused on food insecurity. Hunger is a major issue facing people across the state right now, particularly our college students. nearly 1/3 of all of our college students have experienced hunger. We've been doing a lot on that front by beefing up our food pantries or making it easier for folks to sign up for SNAP automatically. So we're doing all that we can to make the student experience as easy as possible so they can focus on the thing that's the most important, being educated so they can be successful in life.
Yeah, you talk about what testing opens up. We can look, we had people allowed in the Bills game because there was testing done there. We think that's going to allow some of these other events with more people than what we're used to. Thanks so much, SUNY Chancellor Dr. Jim Malatras. We appreciate you coming on the show.
Okay, thank you.